All right, well, welcome everybody to our webinar Wednesday on a Friday for April. So it seems like this month is flying by. So I enjoyed seeing a lot of you last week in Medora at our spring training. That was fun. And so I hope y'all got a lot out of that. I was telling somebody this morning, I can't believe that April's almost over. Anyway, so here we are. And so we're trying to move into fair season and achievement days. And so I'm really thankful that Erin Bain is able to join us today to do a webinar about updates with American Income Life Insurance, our policy that we hold for 4-H here. And your youth are covered through that if they're enrolled, and volunteers as well. So she'll tell you more about that. I know we all need refreshers. We have a lot of new faces, which is exciting. So if you have questions, I want you to just put them in the box and I can help facilitate that as we go or at the end, either one. And then also just to tell you a little commercial for May, get excited because Wednesday, May 22nd is our webinar Wednesday then. And Sam Lawman is going to be doing the webinar then to preparing for county fairs and achievement days, all the things you need to know for that. And I'll send out the official calendar invite next week on that. It wasn't the newsletter, but just May the 22nd, 11 a.m. And that will be recorded if you can't make that. Then we'll take off June, July, and August for the summer and then get back in September. All right, so I'm going to go ahead and turn it over to Erin this morning. And Erin can introduce herself and tell you who she is and everything about herself as well. Erin?
Good morning, everybody, and happy Friday. As Megan said, I am going to keep my camera off. Our home internet is just not great sometimes. For my husband is also working from home, and he's in another room on a meeting. So if the two of us are like have cameras going at the same time, it never seems to work. So I will get my screen shared here in just a second and go through slides. And like Megan said, I basically am going to do a general overview of our division and our types of policies, the two different types of policies that we have, and then talk a little bit about claims, talk a little bit about that kind of stuff, and then just have time for questions. So I am just going to kind of run through things. I'm not, and if you have questions, feel free to go ahead and type them into the chat. And Megan, if you see something that you feel like I need to like stop and talk about right then, just let me know. But otherwise, I'll kind of like wait till I get to the end and then go back and sort through those. So I think that's it. I'll start my screen sharing here and go through our our lovely PowerPoint. I don't know if anybody else has been listening to Taylor Swift this morning. That's what I was doing before I got online. So looking forward to absorbing the rest of that for the day. So yeah, just to give you a little bit of information about the Special Risk Division and about myself. AIL Special Risk started in 1952, so we've been around for a long time. The annual policies that we do have always been that same price, and special activities has gone up a little bit here with inflation, but you know that happens. We try to keep it pretty consistent. And the last time we had a increase in those rates, I want to say was before my time, but it would have been around 2008, 2009, something like that. So it's been a long time. We work with NAE 4-H YDP as well as the other extension professional associations, sponsor those meetings, and I try to attend as much as I can. And in addition to 4-H and extension, we work with a lot of other community organizations. Colleges and universities and camps are some of our other biggest client areas, but I was initially hired specifically to work with 4-H and extension because for those of you that don't know me, I was a county 4-H agent and a 4-H camp director, and grew up as a 4-H'er. So I've been around 4-H and extension for most of my life at this point. There is me with one of my embryology chicks, which I'm kind of getting to the point where I shouldn't share this photo anymore because it's like 10 plus years old, but um, it's just so cute. So I keep that one around. Um, So give you a little bit overview of the two different types of policies that we have. Both of our coverage is blanket group accident insurance, which is different in scope and benefits from a liability policy. A lot of times, folks can uh, get confused about the different types of coverage and things like that. So just remember specifically that ours is accident coverage. As I was talking a little bit about those costs, we really try to keep everything at a consistent and low cost so that it is affordable. Again, as an agent, someone who worked as an agent before in a very rural county, I know how much of a difference a few dollars here and there in a budget can make. So definitely understand that. We are a small division. There are three full-time staff, including myself. So it's me, one person in claims, one person in accounting, and then we have a part-time person who helps with admin stuff. But we really try to keep things as personal as possible, work with folks directly, get back to you, those kind of things. There is no network of providers for this coverage. So as long as you have a medical facility in the area where the incident occurs, you should be able to go to that facility without worrying about how that will affect the coverage from our perspective. One thing to note is that it is written in order to be primary, but most people treat it as secondary coverage. So that means that typically folks will, if there's an incident, injury that requires medical treatment, um, folks will go get their treatment and then submit it to their personal major medical insurance. And then our policy will come in on the back end and either reimburse for out of pocket expenses like copay, deductible, prescription costs, any of that kind of stuff. Or pay the remaining outstanding bills directly to the medical provider. Uh, if someone does not have personal major medical coverage, we can pay primary because it's a primary policy, but most people will submit it as quote unquote normal and then go from there. We do try to get this taken care of as soon as possible once we have everything that we need. Sometimes the thing that really holds up progress the most is honestly just waiting to get the bills, the explanation of benefits, those kind of things that have to go through whatever other processes they go through. But when they get to us, we try to pay those claims as soon as possible. And ultimately, what our division is trying to provide is a resource for you. We want this to be something that is going to reduce your stress level. If there is an incident at an event, know that this is going to have your back as much as possible. And we want that to be, a little thing in your back pocket if you do have a stressful kind of incident. So the annual policy is set up to cover all of your enrolled 4-Hers and volunteers for scheduled adult supervised group activities. So that does include any of your 4-H club meetings. It includes, county events if you have day camps, if you have workshops, if they are. I think someone was asking about a parade. If they're representing 4-H and riding or walking in a parade, they can be covered under that annual policy. So all of your enrolled 4-Hers as well as volunteers are covered under that. But anybody who is not enrolled officially by whatever definition North Dakota 4-H has for that, you would have to take out special activities policies in order to cover those. I'll talk a little bit more about what those policies cover and what the differences are in a little bit. But the goal of the annual policy is really to encompass as much as possible of like a typical 4-H program and cover the enrolled members and leaders for that. There is automatic coverage of new members throughout the year. So we set up the policy to renew every year. I believe this your state renews in September or October. And then, new members who enroll throughout the policy year are automatically covered. there's no, settling up at the end of the year in either direction. So typically the numbers are based on the last full year of enrollment, and then we move forward from there. Anytime that you're not sure about whether an event is covered, and I'm going to say this several times today, anytime you're not sure about anything, please feel free to reach out to me. I am always there to try to help with that kind of thing. So this is the table of benefits for the annual policy. Um, oh, oh, that must be on the next slide. Okay. So here are a few things to note that are not covered. Some of the things that I really like to highlight and hit hard on this is that illness is not covered under the annual policy. It just would be impossible to find a time to set that up, but with special activities, we can cover illness. Injuries sustained during downhill winter sports. So anything like sledding, tubing, skiing, any of that, you do have to take out special activities policies. And children under the age of 5 is really important to note. So if you have families who bring, siblings with them to club meetings or, those kind of things, please make sure that those parents, even if and or volunteer leaders, make sure that they are aware that children under the age of 5 are not able to be covered, and they are responsible for them if they are, in attendance at those types of events. And we'll talk a little bit more about covering illness and winter sports here in a minute. And here is the table of benefits. So I won't run through all of the information here, but just so you see the main ones, the main category, I suppose, that we typically are paying claims out of is this first one, medical and accident for medical and surgical treatment, etc. Up to $5,000. And we find that in a lot of cases that really should be sufficient to take care of the out-of-pocket expenses that somebody has, unless it is a very severe incident. And unfortunately, you see down there at the bottom of the table, we do have coverage for loss of life and dismemberment. We hope that we never have to see those claims, but they do happen sometimes. The most frequent time where we have loss of life claim would be vehicle accidents on the way to and from events. So direct travel to and from events is covered under both types of policies. So that is something to keep in mind. And that is travel, whether it is by parents, if the kids are allowed to drive themselves, if you do buses or vans or any of those types, pretty much any mode of transportation, that direct travel to and from. And I hit the direct part just, to tell people, to kind of remind folks that if they're going, from one county to another or across the state for an event or something, it's fine, obviously, to stop for lunch, to stop for gas, do those kind of things. But if we're stopping at the mall or the amusement park or something like that, that type of thing wouldn't be covered, but it would be covered for the direct travel. Special activities policies. So the annual policy is set, that is in place. You in the counties in North Dakota should not have to worry about any of the administration of that, because that's taken care of for you. But as I said, it does not cover every single program or event. So I'm going to pull up all the bullet points here. Go back. Okay. So special activities is an online activity report that is submitted in advance of the program or event with an estimated number of participants. And then after you pay for the actual number of participants. The online activity report is really simple. It takes about 5 minutes to complete. It's basically your contact information and then a table that asks you to describe your event or activity. This doesn't have to be super detailed or anything. We just need the basics about, what, when, where, and and for the dates and how many people you think you're going to have. So the rates for the policy are 20, 25, or 30 cents per person per day with an $8 minimum. The $8 minimum applies per day for multiple non-consecutive days or to the whole event for multiple consecutive days. So if you have an event that, let's say a sewing class or something that meets every Monday for a month, that $8 minimum will apply to each date. But if you meet every day, Monday through Friday, the $8 applies to the entire event. So some common examples, and I'll actually go ahead and in a second, I'm going to show you a flow chart that may be helpful in determining when you might need special activities and what it's going to cover. But typically, with an annual policy in place, the types of events that you will need special activities for are more limited. Again, if you want illness benefits to be included, you can add that special activities policy to that one event for 25 or 30 cents per person per day. Anytime you have those downhill winter sports, and then any programs that you have that are open to non 4-H youth. So if you have something like a livestock show or something like that where it's 4-H and FFA. It is important to note, though, that because it is blanket coverage, if you count and cover anyone at the event, you have to count and cover everybody. So in that livestock show example, you would be able to cover all of your registered participants as well as those involved in the operation of the event. So for something like that, that may include, judges, ringmasters, parents who are helping with unloading trailers and fitting and moving panels, any of that kind of stuff. You would be able to cover them as involved in the operation of the event. You would not be able to cover spectators and members of the general public. So those kind of folks that are, and again, in the same example, mom and dad who are helping unload the trailer, yes. Siblings and grandparents in the audience are not able to be covered. So keep that in mind when you're kind of crunching your numbers and figuring out who to cover for that. Special activities coverage is most appropriate for what we consider to be controlled events. So again, day camps, workshops, any of those kind of things where folks are coming to the location at the same time, all in one room together, departing at the same time, something like that, versus a more, open organization. So like a festival, fair, those types of things are not considered controlled environments. So special activities typically cannot be used to cover members of the public for those types of events. Oh, gotta click back in here. All right. So, and this flow chart, a lot of folks find to be helpful in kind of determining when we need special activities coverage, and then what you can expect in terms of how to count your participants. Megan, if I haven't already sent this to you, I can send it to you as a PDF so that you can share this with the PowerPoint as well later if you'd like to.
Yeah, I think we have this one too. There is one question in the box, but I think you kind of addressed it, but maybe emphasize again. So the question was, do we have to take out special insurance for everyone or just the non-enrolled members? So
yeah, if you're taking it out for anyone, you have to take it out for everyone. Okay. And here's, some of the stuff that I've already said, but just putting it up on the screen for you. Again, all registered participants and volunteers in an event, regardless of 4-H enrollment, does not cover those who are spectators or members of the general public only. It's important to pay attention to that. But it's hard to decide sometimes. So if you're ever not sure about who that would apply to, you can always email me on that. Collaborative programs are a great time that you may want to consider using special activities if you do things like field days with your soil and water conservation office, or different kinds of stuff like that, where for instance, maybe you're working with the school system and having kids come to rotate to stations and do programming or something like that. Those types of programs, you can use special activities coverage for that. Again, not typically for events where 4-H isn't planning and executing. So if you're just showing up on the day of, maybe it wouldn't necessarily be appropriate, but if you are helping with the planning of the event and running it, you should be able to be covered. And special activities, actually both annual and special activities coverage, all extension program areas are eligible for it. So if you have folks in your office who work with other program areas, with master gardeners or extension homemakers, those groups can use the annual policy, and they also can use special activities policies. So if you're having if you're, a livestock agent wants to do a clinic for youth or something like that, and it's open to non 4-H youth, you can do special activities policies for those days. I'm not going to read through all of this, but again, the important thing to note with the special activities policies is that illness is covered on the 25 and 30-cent options only. So there's no illness coverage under the 20-cent option. And as the rates increase, so do the benefits. So if you're doing a large event for just one day or something like that, and you feel like illness benefits won't necessarily be that big of an issue, you certainly can choose that 20-cent option if the budget is tight. I do tend to recommend the 30-cent options for quote unquote higher risk activities. So anything involving large animals or ATVs, any of that type of stuff where there's contact sports, etc. Those kind of things can be covered at that 30-cent per person rate in order to get the highest benefits available. And that also comes into play when you have events where you only have, less than 20 to 25 people, because if you have 20 people at the 20-cent rate, you do that multiplication for one day, it only adds up to $4, but you would have to round up and pay the $8 minimum anyway. So it makes sense to go ahead and choose the highest rate, get the highest benefits. Okay. Few things to think about. If you've been in your job for more than a week, you probably know that every Murphy's Law comes into place for extension programs. Anything can include an accident. Really, it is very important to make sure that you and your volunteers who are supervising activities, in addition to being aware of this policy, make sure you know that you are reporting things appropriately to the state 4-H office, to your county offices, any of those kind of requirements that you have when you have an incident. Make sure that you're reporting to them as well as us. Your AIL policy and serial numbers are important to have for if you're needing to fill out a claim form. This is the North Dakota statewide policy. If you take out a special activities policies, the serial number will be found in your confirmation of coverage email. The policy number will be in there as well.
Hey,
Few
Aaron,
things.
Aaron,
Yep.
we do have one question. So, the question was, can you how,
Oops.
just address how insurance works for events? Like if you had pesticide training or hosting special spring fever garden forums, or talk about how are these just for 4-H events? So that might be something to kind of address for everybody.
Yeah, so special activities can be used for any extension program or event. So the main, I guess, standard that we would use for determining whether they can be covered and who they're covering is whether it is a controlled environment or not. So it is up to you to determine if you want to take out special activities, but it is available to be taken out for, most workshops that you would do, classes, those types of things, whether it's 4-H or, livestock,, FCS, anything. You should be able to take out the special activities coverage for that type of program. A controlled environment, again, is something that we would consider if everyone is arriving and departing at the same time, everything is in like a contained location, versus something like, let's say, a garden tour where and this is actually a good example. So there's a couple different typical organizations for garden tours. So a garden tour where everyone meets at the extension office or another central location and gets on a bus or into vans or personal vehicles or whatever, and you go around to, the 5 different sites together, arrive and depart at the same time, everyone's traveling together, that type of thing, that can be covered under the special activities policy. Whereas a garden tour that you're given a list of, these 5 or 10 different locations in the county where some people have said, we're going to open up our home for the garden tour. Folks can choose to go to, 1 or 2, or they might go to all 10. They can go in any kind of order. They may, go to one more than once, or, any of those kind of things. That would not be considered a controlled environment because we would not be able to track adequately people's arrival and departure. Yes, Sally Smith was at location 1 from, 10:14 to 10:17 a.m. and then, she went there. So that's the kind of thing to keep in mind. And hopefully that's clear. But again, if you're not sure if something can be covered or who would be covered under special activities, feel free to email me or email Megan, and she'll copy me if she can't answer as well. We're always happy to do that. So let me go back to sharing my screen here. I accidentally clicked away from that. And okay, share. So a few things to think about for filing a claim. There you go. All right. So if you do have an incident, an injury occurring during a program or event, I do recommend that anytime that there is outside medical treatment necessary beyond, basic first aid, we recommend filling out our claim form and submitting it as soon as possible after the event. It is always, generally for our purposes, better for us to have that claim form on file and not need it than need it and not have it. And it may be a circumstance where, someone twists their ankle, it doesn't end up being a serious injury. And maybe the family only has, a $25 copay or something like that, and they say, don't worry about it. But, bills can come out of the woodwork sometimes, and the policy does cover ongoing treatment for up to 52 weeks from the date of the incident. So, there could be other things that come up. So it's better for us to have that on file and not need it. The claim form is available online, and I think I saw some links in the chat. It's probably available in your intranet kind of stuff as well. But it does have to be filled out by somebody not related to the patient. So keep that in mind if you have volunteers that are parents and their kiddos, may get injured during their club or something like that. The form has detailed instructions, and you should be able to kind of fill that out as completely and submit it to us as possible. But there's the email address. We recommend submitting by email if you can, but you can also mail hard copies or fax it to us. One of the things that I always tell folks to keep in mind is that once you've got that claim form submitted, the patient or the claimant will get communication from us, as will you as the policy holder. So if we are reaching out to you for help with communicating with parents or guardians or those types of things, we really do appreciate you kind of playing the middleman sometimes in those circumstances when we're trying to make sure that we have all the information we need to file the claims. And that is sort of the meat of it. So I know I went through that really quickly. I know there's, insurance can be extremely um, daunting of an area to think about. Before I started this job, I did not know virtually anything about insurance, and I still don't know that much beyond our very niche little product. Um, but I'm always happy to help however I can. So I've got my contact information there, and I think Megan will be able to share it as well. Um, but yeah, at this point, I think that's the bulk of the presentation, and really just want to give y'all time to ask questions and go from there.
One question in the chat box, Aaron, is do we need special activities um, or anything special to take a 4-H group or to an out-of-state event?
Not specifically, the annual policy would cover them for accidents under that out of state under the annual policy. But if it is an overnight out of state event, you may want to consider adding special activities at 25 or 30 cents so you can get those illness benefits. Illnesses that we find that come up for uh, travel events, stuff like food poisoning. We've had like different kind of outbreaks of gastrointestinal stuff while folks were at camp or those types of things. So overnight events would need uh, illness coverage.
I have a really quick question. Sorry, I hate typing. So we actually had one of our kids at state this year get sick and had to go to the hospital. How would I go about putting a claim? I don't want to put a claim in, but I'm like, how do we do that if we wanted to do that? Do we send it to the people who were doing the state? Or how does that work? Like, I don't know.
So was it an illness or
Yes.
an injury? Okay.
No,
So
she actually had influenza A, and we ended up taking her to the hospital that day after the contest.
Yeah, so unfortunately, because that would be considered an illness, it would not be covered under the annual policy. So
Good. Okay, that's what I was wondering.
if you had special activities coverage for that event, at the 25 or 30 cent level, then that would be able to be covered.
Okay, but do I need to do that when we go to like state competitions for my own clubs, or is that I don't need to do that?
That might be a question for Megan in terms of like, because some other states do, like the state office will do special activities coverage for their Congress or those types of events. Is that kind of what you're asking?
Yeah,
Or
yeah.
What event were you asking, Sandy?
Okay, so one of our kids at the state hippology contest got sick, and she ended up having to go to the hospital. And she had influenza A. We had to pull her out and everything. Do you guys care? I'm not asking because we don't want to put a claim in or anything. I'm just asking if that were to happen and I did have somebody who wanted to put a claim in, do we go to you or what is there? That's what I'm asking.
Well, we don't usually take it out like special for always with like the state.
Okay, that's what I was wondering. Okay.
As far as I know. Yeah. But but you already covered like for the state policy.
Right, the statewide one. So if I wanted to, I would need to take out insurance on my own for special activities, correct?
Right.
Okay, that's all I
if
needed
you
to
wanted
know.
to have that illness coverage.
Yeah,
Yeah.
Okay, so we have a kind of a long one from Annette.
Okay.
So would it be needed for achievement days or fairs as the majority of people participating are enrolled 4-Hers or volunteers who are already covered by the annual policy? It sounds like the only others that could be covered at the fairs would be parents and judges who participate in the event, which would only be a handful of people, but we would still need to pay for everyone. I'm just checking to see if I have it right.
So short answer is yes, you do have it right. You need to count and cover all participants and volunteers who are involved in the operation of the event if you choose to take out coverage. So there's a couple of different options, right? The annual policy already covers your 4-Hers and your volunteers for events like achievement days and fairs. If you want to have coverage for the parents or judges or additional people who are helping with those events, you would need to count and cover everyone. And that's not everyone for the entire event, members of the general public, 10,000 people going to like, grandstands and that kind of thing. But you would need to cover the exhibitors, the 4-Hers who are like showing or doing events, those volunteers, and the and the judges and extra parent volunteers and that kind of thing. The reason for that, it's a blanket policy, so it is meant to cover all of the members of a defined group. And for those event type policies, the reason we ask that if you cover anyone, you have to cover everyone is because in the circumstance like that, let's say everybody is at the achievement days in the livestock barn and a tornado hits the building, right? Not very likely scenario, but it could happen. And if we had something like that, it would be difficult, if not impossible, to sort out in that kind of circumstance who's covered under the annual, who's covered under special activities, because the rates and benefits are different. So if you cover anyone, you have to cover everyone. And I think you understand it. I'm just reiterating it for everybody else. Richard asked about camps at Washburn. Camps would be covered if if the participants are enrolled 4-Hers and they are attending 4-H camp, they would be covered for accidents under the annual policy. Okay, Rochelle, excuse me, many are not 4-Hers. So if they're not enrolled 4-Hers for camp, you have a couple of choices. You can either get them enrolled and then they would be covered under the annual policy, or you can take out a special activities policy for that set of dates for camp and count and cover everyone.
Just a side note for camp, Megan, can you hear me?
Yeah, go ahead, Carla. I was
Just
gonna
a
ask
side
you.
note for camp, Holly has gone through and already put in for special event insurance for camp. So as a camp program chair, you do not have to take that out. We've already done that for you. And so she's got all of the weeks covered for summer camp.
Great. Thank you. Thank you,
Thanks,
Carla.
Carla.
I appreciate that.
Yeah, thanks, Carla. And then back to Rochelle's question, Aaron. She was talking about how your slide says they aren't covered on the plane. Like if
Correct.
one to conference or Congress. So are you saying the special policy would cover that?
No, air travel is not covered under our policy. So they're covered like right until they walk up onto the plane and then when they get off on the other side for travel for those events, but they would not, like if the plane physically crashed, it wouldn't be covered under us for that.
So are they not covered anywhere at all? Just to clarify for Rochelle.
I do not know what additional coverage conference and Congress, might have that would cover that, but surely there would be coverage, liability coverage from the airline, or there might be other types of coverage that would be enforced, but our specific accident policy would not be covered.
Okay. Did you want to address the questions that I sent you ahead of time? A few of those?
I tried to build them into what I was talking about, but let me go back to that email and make sure that I didn't miss anything here.
I know you talked about the parades.
Yep. So, okay, regarding club meetings, we encourage everyone to be enrolled in 4-H online so they're covered, but that doesn't always happen. Should I be taking out special risk insurance for every club meeting? Again, the short answer is no, because ultimately, if people are participating in a meaningful way in those club meetings, at either as a youth or as a volunteer, they should be enrolling officially. Same thing with like, but again, I know that parents bring siblings and, you know, they're doing a cool craft or a fun activity, and sometimes they're going to jump in. It's just important to to let those people know that they are not covered under the policy. So if they do choose to participate, they're kind of doing so at their own risk. I would not personally recommend taking out special activities coverage for every club meeting. I think that it's overkill. It's not going to, it's going to be more administration for you. I wouldn't recommend doing that. Other questions? Extension programs with youth. If an agent is conducting a community program like a tree workshop or planting with youth, some of whom are not enrolled in 4-H, should I take out special insurance? You should, if you want to have coverage for everyone. And again, that's a circumstance where you would count and cover both the 4-Hers and the non-4-Hers. There's a parade question. I think we talked about that. So hopefully, yeah, and if, did I miss anything else in an email, Megan, or?
No, I think that was the parades
Okay.
and other two at the club, so. yeah.
Okay. And anybody else, you know, feel free if you want to raise your hand. You can do mics or type in the chat. Either way is fine with me.
I have a follow-up to the question you just addressed about an agent doing a program with youth.
Mhm.
And this is maybe a NDSU more question. Are agents programs covered under NDSU anywhere, or do we only have this special risk insurance?
I think that might be a Megan question in terms of, you know, what additional coverage the university has. You speaking from my experience, typically all universities have some coverage for 4-H and extension, you know, programs, whether it's a liability policy or, you know, something like that. There is some coverage in place. Ours is just this very specific accident coverage.
Yeah, Tori, I haven't always been able to get a clear answer on that. So that's kind of something that I've tried to ask to clarify, but I will work on that again and follow up with you about that, because that is kind of the question of the day, to see like what pieces NDSU exactly covers or doesn't cover. So I'm glad you asked that again.
Awesome. Thank you, Megan and Aaron.
Okay. Anybody else? When there's not a whole lot of questions, I'm never sure if that means that I covered everything or people are scared to ask. Best way to contact you to sign up for the special event insurance, email or phone call, how far in advance of the activity. So there is an online activity report that you will submit in advance of the activity. And I tend to recommend doing that at least, you know, 24 hours in advance, but the activity reports are time stamped. So as long as you get it in before the event, you know, officially begins, you will be okay. This is what the activity report looks like. So it is, like I said, it's kind of deceptively simple almost, but you go to this online form, select 4-H and extension, and then fill out your contact information and the information about the activity down here at the bottom. If you ever want a refresher of what the rates and benefits are, you can click on that view rates option and it'll give you this little pop-up window that shows what the benefits are for each different area. And then once you submit that form, you will get an email with we'll get one email right away with a copy of your submission, essentially. And then once it's been reviewed and processed by our staff, then you'll get another email with a confirmation of coverage.
And that we have a link directly to that form, Annette, on the FAQ document as well. It'll take you exactly to what Aaron just showed you.
And I just put a link in the chat box as well.
Did you address how soon like after the event they have to pay or anything like that?
You know, the sooner the better, but we don't usually start like hunting people down until we send premium due reminders at the end of each month for like the prior month. So, you know, when you receive that is a good rule of thumb. As soon as the event is over, if you have like a county office checking account and you can write checks, you can send the check, you know, the second the event is over for, you know, for our purposes, that's fine. You know, you just whatever makes the most sense to you in terms of when to get that submitted. I had an outstanding bill from like 6 months earlier when I applied for the job with AIL. So, and they didn't flag me for it, so that's good. Trying to get back, my chat window disappeared. Okay. Great.
Does anybody have any more questions? Thank y'all for asking these
Mhm.
questions out loud. And I'm sure because if you have a question, I know somebody else does. So I'm glad
Yeah,
that
absolutely.
you spoken up.
Yeah.
Mhm.
And anything that hasn't come up today or that you just don't feel like typing or you don't feel like, you know, asking further about, you know, again, I will say it till I'm blue in the face. You know, please shoot me an email. I try to get back as soon as possible. I know sometimes I, you know, like everybody, we miss stuff, but email really is the best way to get in touch with me, and I will try to get back in touch with you as soon as possible. And yeah, Rochelle, that's a good point. I do have that on my, I'm gonna double check now and make sure I've got it on my calendar for May 17th. It's right there.
Rochelle, you want to do a little commercial for that?
Yeah, so Carla Mickle, we had talked, and Megan and I had talked in our office that while obviously, as Erin said, the claims need to come through or our volunteers need to contact you as NDSU Extension agents or professionals out there. If there is a claim, we do want to just walk through kind of what Erin said today with volunteers and how that applies, just having them see these forms. So we want to do a lunch and learn for that. And then we will record that one so that it can be on Zoom up on our website. So if volunteers have questions, I know there was an issue that came up on a weekend, which Leanne and Carla and others handled, but just so they kind of know how to walk through or do those things. So Erin is kindly going to come on that Friday, May 17th. And we're just trying these new volunteer lunch and learns for our 4-H volunteers, at least during the school year. We'll see about the summer. Next week is Adrian's lunch and learn on outdoor skills. And as soon as that one is over, we will be marketing this one for Erin to come on. And this is on the extension calendar. We just haven't sent out too much about it yet because we want people to first participate in Adrian's. So thanks, Erin, for being willing to do that for us.
Oh, absolutely.
And just another clarifying statement, Holly is going to start taking out insurance for any overnight state 4-H activities that we have. We already do it for EYC, and Adrian does it for like shooting sports, but we're going to start taking out like at the state level for overnight events. So that might help clear up a question you had, Sandy, earlier about the events, bringing them overnight. So Holly will be doing that going forward.
Yeah, I wasn't complaining. I hope everybody knows that. I was just trying to figure out what the heck if I had somebody do that. So
No, you are not complaining at all. Like,
okay.
I'm so glad you asked that because that's something that we need to be aware of. And like, I'm sure the people had the questions too. So thanks for asking that. And that brought that to our attention and gave us good feedback. So thanks for asking that.
Okay.
All right. Any more questions? And I'm gonna add her PowerPoint to our Google Drive slide or folder. I'll send out this recording as well. And then there's a FAQ document. We put a link to that in the chat box. And while we've been meeting, Leanne's been adding some of these questions. So we can keep those at the forefront that you asked today. So you can go back and look at answers there. So are there any more questions for Erin or comments or anything? This is your chance to ask the expert now.
Megan, not so much for Aaron, but in addition, can we just talk about like the other form that has to be filled out? So like we have the American Income Life. We had an instance this past weekend up at State Archer. We had 2 of them, and we had to fill out the American Income Life information, and then we also filled out the non-employee Leanne, what's it called? Non-employee incident form from
Yep.
NDSU.
Yep, there is 2. So there is the non-employee one, and the link is also at the top of the FAQ form.
Okay, so just so we filled both of those out, and then making sure in a timely manner we get that back to NDSU as our report. I just think that's important too, because we have like 24 hours to get that reported to the safety office, correct, Leanne?
Yes, that is correct.
And if you, just a plug for that, our deadline is not quite that quick. We do ask that claim reports be filed within 20 days, but so we ask within 20 days, but no later than 90 days after the incident. And again, for our purposes, it is way better to have that on file and not need it than the other way around. We would rather, send out a couple of pieces of paper asking if you're going to, move forward with the claim than, find out 6 months later that there's thousands of dollars in bills that we're not able to help with because we didn't get the claim form in time. So you don't need to be, emailing me at 9 p.m. on a Saturday panicking, but the next couple of weeks, put it on your to-do list to send in that claim form.
I put the link in the chat box too, but that's also number 1 on FAQ document letter G. Is that what you were talking about, Carl? Does that help? Is that
Yeah,
correct?
just
Okay.
so like when you have the American Income Life and then also the form for NDSU, like either the near miss or, the accident report, just so that you're getting both of them in a timely manner. Just like Aaron said, it's better to have it on file and not use it than not to do it at all. And that particular day we had like the parent right there helping us put in the information for the youth that was participating and all of that. So if you have that and it's available right away and you can capture that instead of trying to go back and do it later, it's just a lot easier to remember all the facts is all. So that's what I was trying to say. So thanks.
All right. Any more questions? These are all been great discussion. So I appreciate everybody asking. Oh.
Yep. And just one more time, don't feel like you have to speak up right now, but anytime you have questions, please feel free to reach out to me. I would rather answer, a dozen emails in advance, with questions than one after saying, oh my gosh, we didn't have coverage and now what do we do?
And we'll work to get better clarification on exactly what like NDSU does and doesn't cover for sure. And we can add that to the document. So if that's it, then don't forget May the 22nd, that's a Wednesday, 11 o'clock, that's Webinar Wednesday, and Samantha Lawman's gonna be leading that session on county fairs and achievement days, getting you ready for that. And then we'll take off the month of June, July, and August for Webinar Wednesday and get back in September. So I will send out the calendar invite next week for Sam's presentation on the 22nd, on Wednesday, May 22nd, at 11. All right. Well, thanks everybody for joining, and I hope you'll have a good weekend. Bye.
Thanks, everybody. Have a great weekend.